Episode 3, Ketamine and Esketamine Programs Done Right. Hey, it's Adam Sewell, MD, and welcome back to the Medical Entrepreneur Channel, where we help physicians grow modern, independent practices that serve patients and create freedom. Today, we're going to talk about one of the most powerful and misunderstood treatments in modern medicine, ketamine and esketamine therapy. This therapy has generated incredible results for treatment-resistant depression, chronic pain, post-traumatic stress, and even some forms of neuropathic pain. But it's also an area where physicians are getting into trouble, mostly because they don't understand the rules or they copy business models from non-physicians. So in this episode, I'm going to show you how to build a safe, compliant, and profitable ketamine or esketamine program inside your existing practice. You'll learn what's legal, what's risky, how to build clinical structure, how to price it, and how to integrate it with regenerative and performance medicine. Let's get started. Section 1. Understanding the science and the difference between ketamine and esketamine. First, let's clear up a common confusion. Ketamine is an anesthetic that's been around for more than 50 years. It works primarily as an NMDA receptor antagonist and increases brain-derived neurotrophic factor, or BDNF. That's the molecule that helps neurons grow and form new connections, the biological foundation for mood and cognitive repair. Esketamine, on the other hand, is a derivative. It's one enantiomer of ketamine, marketed under the brand name Spravato. Esketamine is FDA approved for treatment-resistant depression when used under a REMS program, which means Risk Evaluation and Mitigation Strategy. So here's the key point. If you want to run a fully compliant esketamine program, you must enroll your clinic in the REMS program, have DEA registration, and maintain the ability to observe patients for 2 hours after each dose. If you're using standard ketamine, you are working off-label, which is legal in medicine, but requires good documentation, informed consent, and ethical clinical use. Section 2. How ketamine works, the clinical mechanism. Ketamine's mechanism is fascinating. At sub-anesthetic doses, it increases glutamate release and activates AMP receptors, leading to rapid neuroplasticity. In depression, this rewires circuits that have been dormant for years. In chronic pain, it interrupts central sensitization, basically resetting the nervous system's pain pathways. This is why some patients describe it as turning down the noise or feeling like their brain reset. The changes can happen within hours instead of weeks, which is why ketamine is considered one of the most promising breakthroughs in psychiatry in decades. Section 3. Clinical models you can offer. There are 3 main models you can implement in your practice. Model 1. Infusion-based ketamine therapy. This is the gold standard for depression, anxiety, and chronic pain. Typical dosing is 0.5 milligrams per kilogram over 40 minutes with continuous monitoring and IV access. Model 2, intranasal esketamine therapy. This is the FDA-approved option. Dosing and observation must follow Spravato REMS requirements, and the patient cannot drive home after the session. Reimbursement is possible, but setup is more complex. Model 3, oral or sublingual microdosing programs. These are lower dose at-home adjuncts that can be used for maintenance under physician supervision. However, they require strict patient screening, telemedicine compliance, and clear informed consent. If you're new to this space, start with the infusion model. It offers the most control, best outcomes, and clear differentiation from non-medical ketamine clinics. Section 4. Setting up a ketamine program in 30 days. Here's a simple 4-week roadmap. Week 1. Training and protocols. Complete a medical training course focused on ketamine for depression and chronic pain. You'll need infusion protocols, consent templates, and emergency procedures. Week 2, equipment and logistics. You'll need an IV pump, blood pressure monitor, pulse oximeter, emergency medications, and a quiet treatment room. Many successful clinics use reclining chairs, ambient music, and eye masks to create a calming environment. Week 3, patient selection and screening. Screen out patients with uncontrolled hypertension, recent stroke, or active psychosis. Baseline labs and an EKG are recommended. For psychiatric patients, coordinate with their primary provider or therapist. Week 4, marketing and launch. Begin with your own patient list. Patients with depression, PTSD, neuropathic pain, or fibromyalgia are ideal candidates. Then expand with targeted ads focusing on breakthrough treatment for resistant depression or neural reset for chronic pain. Always emphasize medical supervision. This differentiates you from the non-physician wellness ketamine providers. Section 5, patient experience and integration. A successful ketamine session is not just about the infusion, it's about integration. You'll want a calm, supportive environment with pre-session preparation and post-session discussion. Many clinics partner with therapists or coaches for integration sessions, helping patients process insights and reinforce neural changes. This combination of medical treatment plus guided integration dramatically improves outcomes and retention. For pain patients, integration might mean physical therapy or functional movement. For psychiatric patients, it may involve journaling or cognitive behavioral reinforcement. Section 6, pricing models. Let's talk numbers. A single ketamine infusion typically costs between $400 and $700, depending on your location and level of service. A 6-session package is the standard for depression, usually spread over 2 to 3 weeks. You can also offer membership-style maintenance plans for ongoing support, such as 1 session per month plus coaching or check-ins. Esketamine programs can be billed through insurance, but they come with higher overhead and compliance requirements. For most physicians, the cash-based infusion model provides better flexibility and profit margins. Example, if you treat 10 patients per week with 6-session packages at $3,000 each, that's $30,000 in gross revenue per week, with minimal variable costs once your setup is complete. Section 7, safety and compliance essentials. Now let's make sure you stay safe and compliant. 1. Always perform a full pre-procedure assessment and obtain informed consent that clearly states the off-label nature of the therapy. 2. Maintain ACLS certification and keep resuscitation equipment nearby. 3. Never delegate IV ketamine administration to non-licensed staff. 4. Document every step, vitals, dosing, patient experience, and post-treatment recovery. 5. For esketamine, comply with REMS observation requirements and reporting. And very important, do not advertise ketamine as a cure or guaranteed outcome. Focus your message on evidence-based hope and physician-guided care. Section 8, common pitfalls to avoid. Here are the biggest mistakes I see clinics make. Number 1, they copy marketing from med spas that promise unrealistic results. Stay medical. You are a physician, use that authority to educate, not exaggerate. Number 2, poor follow-up. Patients need structured follow-ups for safety and to track progress with validated scales like PHQ-9 or GAD-7. Number 3, lack of communication with the patient's other providers. Always coordinate with the primary care or mental health provider to ensure continuity. If you fix these 3 mistakes, your clinic will stand out immediately. Section 9, expanding beyond ketamine. Once your ketamine program is established, you can expand into related service lines. Many successful clinics bundle ketamine with regenerative or performance programs. For example, low-dose ketamine infusions combined with neurostimulation for chronic pain, ketamine-assisted psychotherapy packages, post-infusion recovery optimization with red light therapy, NAD, or nutrient IVS. Each of these adds both value and differentiation to your practice and can be billed as separate cash-based services. Section 10, closing and next steps. Let's summarize your action plan. 1. Decide whether you'll start with ketamine infusions or an esketamine REMS program. 2. Get trained, create your protocols, and set up your safety equipment. 3. Develop a calm, professional patient environment. 4. Market ethically, emphasizing medical oversight and patient outcomes. 5. Build follow-up and integration into every patient journey. If you'd like a free checklist that includes setup equipment, dosing templates, and sample consent forms, download it using the link below. This is Adam Sewell, MD, and this is the Medical Entrepreneur Channel. If you want to learn how to integrate advanced biologics, performance medicine, and regenerative therapies into your practice, subscribe now and I'll see you in the next episode where we'll cover shockwave therapy for pain and performance medicine.